If you've recently been injured in the gym or you feel held back by old injuries whenever you try to get back into the gym, give me 5 minutes and I'll show you exactly what you need to do. My name is Dr. Brad. I'm a chiropractor and a strength coach, and I help active people overcome aches, pains, and old injuries so that they can perform their best. And as a thank you for watching this video, I'll get you special access to one of the 5 open case study spots that I have right now. Just comment case study below and I'll get you all the details. Now, first off, and I know this goes without saying, but I don't know exactly what's going on with you and your body and your injuries. So if you're at all concerned about a serious injury, please go visit your doctor first and make sure that you are cleared for exercise. There's 3 things that I typically will do with a new client or a patient that comes to me and they have some aches, pains, they're bothered by some old injuries whenever they're lifting. But before I do any of the 3 things, the very first thing I want to do is give you reassurance and encouragement to keep moving. The most important thing you can do when you have aches, pains, you're struggling with an injury, is to keep active and find a way to do some level of physical activity, exercise, while you're recovering from this injury. In most cases, the worst thing you can do is complete rest, because when you go through complete rest and just take a ton of time out of the gym, your body detrains. It gets weaker and it gets more prone to injury when you eventually do come back to the gym. I know it's a cycle that a lot of you have probably gotten stuck in, where you start back at the gym, you get some type of injury, you take some time off, you feel better, so you go back and you get injured again. It's because you're never allowing your body to actually get stronger. It's this cycle of getting weaker, injury, getting weaker, injury. And you can never get out of that cycle unless you find a way to keep moving. And that's what this video is all about. For the sake of simplicity in this video, I'm going to use the squat as an example most of the time, but you can replace the squat with any other exercise that makes sense for your situation. Now, let's say someone has back pain, knee pain, hip pain, some type of lower body pain while they're performing a back squat in the gym. Now, to figure out what the best course of action for you is, let's think about when you feel your pain. If you feel that pain during the squat, only at the very bottom of the movement, and it hurts every single time. So you get to the bottom of that squat, your knee hurts or your back hurts, but you come up, it feels okay. In that case, we need to cut range of motion. So that can be as simple as adding a box or a bench just above that point of pain. So you're still doing a close to full range squat, but you're stopping that movement just above that painful range of motion. This is not a forever fix. What this is allowing you to do is to continue training, continue getting your body stronger while you work to recover the pain going on in whatever problem area you have. Now we need to progress. Just like you would any other movement, you want to do 3 to 4 weeks of this, progressing your weight, your sets and reps just like you normally would. And then you can try to lower that box or that bench just a little bit. So you're getting just a little bit lower, kind of creeping back towards that painful range of motion. If that feels okay, great. Continue your progression there. Do 3 or 4 weeks at that height, increasing your weight, your sets, your reps, and so on. Now, the number 2 scenario is whenever you feel pain with heavy weights. So all of your warm-up sets feel great. You feel great in the warm-up, you feel great in your first couple of sets of squats, but as soon as you get to your heavier sets, you feel pain. Now, this one's pretty a given, sounds obvious, but just don't go past that point for a while. Now, we want to still make sure you're progressing. So what can we do? So let's say once you get above 80%, 1 rep max, you have pain. What we need to do, all of our working sets need to be below that 80%. Again, obvious. But then what we do is we'll increase the volume under that percentage. So for example, let's start with just a basic 3 sets of 10. That's 30 reps at say 75% or even 70%. You do your 3 sets of 10 at 70%. That's 30 total reps. Now for the next week, we're going to increase the total number of volume. So we either can add a set and do 4 sets of 10 to where we're doing 40 reps, or we do 3 sets of 12 to where we're doing 36 reps in that session. Gradually increasing the volume to what that's going to do is that's going to increase your body's capacity and your endurance to where your muscles are still getting stronger and more resilient. But again, you're not irritating the tissues that are already irritated. And the third situation is probably the worst case scenario. And that's where you'll have pain during all ranges of motion, all or most intensity. So any considerable amount of weight. What do you do? And this is where you typically need to entirely change the exercise or at least the position of the exercise. So again, kind of using the squat as an example, most people go to back squat. inherently. That's the first thing they go to. It's the most common movement pattern. We can try adjusting where the position of the barbell or the position of the weight is. So we can try a front squat. What a front squat's going to allow you to do is that shifts the weight further forward. You'll be able to keep a little bit more of an upright posture, and that just changes the effect of where you'll feel it on certain joints. Now, obviously, that may be better, it may be worse, depending on what your actual situation is, but that's just an example. We can try a goblet squat, or you're holding a kettlebell or a dumbbell out in front of you that puts that weight even further out in front of you so that you can change the mechanics even more. Or we just go into a totally different pattern like split squats, lunges, focus more on our hinging patterns like our deadlifts and our RDLs, or even doing machine-based work for a while. There's a lot of situations where it may make sense to work primarily on like machines and cables while you're working to heal some type of tissue injury. Now let's recap. The first situation is when you have pain at the bottom or the end range of motion. First thing you're going to try to do is reduce that range of motion until you're at a pain-free range, and then you're going to progress there over the course of a couple of weeks, gradually increasing that range of motion again, trying to work your way back up to full. The second situation is when you have pain only at heavier loads past a certain percentage. Well, then what you're going to do, reduce that load, only operate in those moderate weights, but increase the volume, your sets and your reps, gradually increasing that percentage until you get closer and closer to that threshold point and try to progress past it. Now, the third situation is pain either in the entire range of motion or pain with any considerable amount of load. And then that's where we're going to look to change at least the position, if not the entire exercise, and try to find a way that you can train that body part pain-free. Now, if that was helpful for you, please like and share. And don't forget, as a thank you for watching this video, I'll get you special access to one of the 5 spots in my case study. Just comment case study below and I'll get you in.